When I first started with Providertech, even as a user, sending text messages to patients was a brand new concept, right? And we were very innovative at the time. And so it now feels like we're in that second wave of, how are we making it easier for people to communicate with their healthcare team or even their payer, right? That's an important piece of the equation as well.
Welcome back to the State of Business Texting podcast, where we talk about all things messaging. I'm your host, Caitlin Long, Senior Director of Product Management for Messaging here at Bandwidth, and I am joined by Zach Kunkel, Director of Solution Marketing.
Hey everyone, on this podcast, we are taking our listeners behind the scenes and having candid conversations with messaging industry experts.
That's right. And today we are joined by Lisa Tejada, VP of Clinical Innovation at Providertech. Lisa, thanks so much for joining us today.
Yeah, thanks for having me. I'm excited for our conversation.
Yeah, so maybe just starting out, tell us a little bit about who you are and where you work and what exactly Providertech does.
Yeah, happy to. So as you said, I'm the VP of Clinical Innovation here at Providertech. I am a nurse by background. And so most of my early career, I spent doing what you imagine a nurse is doing, right? I worked in the hospital. I worked in critical care, ICU, the cardiac cath lab. I made a shift about 10 years ago to working on the outpatient side of things, where I have been busy creating and implementing programs to help support patients more proactively. And as the healthcare industry slowly but continuously moves towards value-based care, I've been designing programs that really support that. And I was an early customer of Providertech, so that's how I got involved. I was using their tools to be able to start to do some outreach and messaging to patients. And so what Providertech really is a healthcare technology company. We use a variety of different tools in our toolbox. Most commonly, we use conversational AI and HIPAA-compliant text messaging to really just improve communication between patients and their providers or their clinical teams, right? It might be their nurses, their health coaches, their behavioral health, anyone on that team often is who are using our tools.
Wow, a lot there. So crazy that it seems like you are the biggest success story from Providertech, probably a customer turned employee and advocate. That is pretty cool. So when were you first introduced to Providertech on the being a customer side?
So I think that it was about 2016, somewhere in that neighborhood. And they were a new startup at the time. And so they had they had healthcare experience in terms of technology, right? That was the space that they operated in and built this solution. But their experience was different than mine. So I became like the early product person without realizing it, right? I was like, oh, can we do this? And can we do that? And how about we try this? And have you guys considered this?
A super user.
Yeah, right? And so, we even joked some of the more complex things later that we came up with that, now I'm on the Providertech side having to maintain and manage it. I was like, well, you could have told me no at any time. I just kept asking for things.
Oh, that's awesome. So when you say VP of Clinical Innovation, does that translate to product management, or what does that really entail?
As you might imagine, in a smaller company, it's a lot of things. So there definitely is product work. I work really closely with our development team to develop new things, continue to hone our existing tools. But I also do a lot of customer facing work. And really when we are working with a customer, the tools that we're talking about are just that, they're tools. So we're really working to build out a solution that works for them. So if their goals are to improve their operational efficiency, they want to be able to message patients before visits and, remind them to, bring certain things, arrive early, confirm their appointment, right? We can help create a solution that we're sending messages out to do that. And we're using those tools to not only deliver it, but also to build the timing and the cadence of messaging and the responses that make the most sense for patients. And so I do a lot of that design work and implementation working with clients.
That's awesome. So one of the big questions we always ask our guests is, how do they use messaging to accomplish their mission at their business? So you just hit on some of those, but as a patient myself, the most common interaction I have with a provider is the classic appointment reminder. Will you be there? Confirm or cancel, reschedule. But you were just listing a lot of different ways that Providertech is using messaging. So can you highlight a few more of those beyond the, hey, are you going to be there, Lisa? Which, hey, super helpful and impactful, but not always the most innovative.
Right. As I say, there's a lot of a lot more interesting things. And so whenever we talk about our solution, we talk both about inbound and outbound. And depending on what the objectives are, what's going to be the best tool. And so for inbound, we do a lot of support in healthcare call centers. And that's both with actually answering calls, using AI agents to answer calls, but also using some of those same agents to respond to texts in real time, right? So if the patient is, asking questions about the practice, and we talked about some of those operational things, right? Just a moment ago, but there's a lot of really repetitive interactions that, as a patient, you just need one quick thing, right? Like, where do I park? Is there parking available? Is there a doctor there that speaks Spanish? I just need a refill. I'm going to run out of medications before my appointment. And those are all things that we build into the workflows that the agents can then respond to in real time to the patients. And so, this, when we talk about this, the customer expectations with communication, when we're in other industries, we have certain expectations that we want quick responses, and we expect that. Healthcare still limps along, right? It's not performing at the level that other industries do. And so using tools like this, especially when we align them with something that is more automated, allows patients to get that information, get it right now, and often even without using a human resource. I talked about a call center setting. I previously managed a large healthcare call center, and it's a really hard job, right? You're taking 100 calls a day. And the other really tricky piece when you're managing that and, trying to provide great service for your patients is the turnover annually in a call center ranges between 30 and 45%, right? So you're like filling a bucket with a hole in it constantly. You're constantly hiring, bringing on new people, training them up, because when they're leaving, not only is there a vacancy, they're taking that knowledge with them. And so that's why our tools are really so exciting. They're really providing much more consistency in if there are vacancies, and there are always vacancies, then we can use these tools to really fill that gap and still respond to patients really timely. And then when there's something is more complex, they can be routed to somebody, to a live agent to address that.
It's super interesting and then highly relevant for me. So a little more context as to why. So I actually just got back from Miami. There was a messaging ecosystem forum, which is a group of individual entities, organizations, aggregators, contact center providers, maybe CPaaS companies, carriers that really position themselves as key players in the messaging sort of ecosystem. And one of the panels that I was on, we were actually talking about the intersection of like contact center platforms and communication platforms, like one that Bandwidth offers, and how that can really help leverage both provider experiences as well as individual end user experiences. And so we got to talking actually about burnout of contact center agents and utilization of messaging channels. And one of the things we talked about is, helping to kind of pull some of the load off of those agents utilizing the sort of the messaging channel in conjunction with some of the evolving tools that are happening in sort of AI and chatbot. So it's being able to pull some of the work off of the agent, helping to overall, I think, decrease kind of the burnout of said agent, and just overall leveraging both consumer, patient, provider experience as well as actual contact center experience.
Absolutely.
And when we were talking about that, the other thing that came up, I think, was because of a lot of those factors that you and I kind of just chatted on, and you mentioned, that was also mentioned in the panel, the conversational nature of the discourse we've seen sort of increasing, which is really interesting. And so specifically what I mean, right, is when you're actually engaging, whether it be with a human or a chatbot, we've actually seen the messaging channel start to become less templatized, less transactional, and more conversational, being driven by both the AI tools and then also just like externalities of you and I as consumers and patients just expect a more conversational, more personalized experience. And so I'm wondering, as that starts to evolve, the more conversational nature of just healthcare messaging in general, how are you handling that within your sort of messaging strategies today?
Yeah, it's a great point, and it's something that is really exciting. So the piece that I've already talked about is really around operations, but we do a lot of clinical outreach, right? That's how I first got introduced to Providertech and how I've been here ever since. And so the early work is we had very templated messages, and this message went out 7 days later if this patient didn't respond, right? It was very, very precise, but that's, we're now evolving that it is much more personalized. So this patient may need just a gentle reminder that it's time for their annual wellness visit, right? And they, even just receiving the message, they, click within the text message, they schedule their appointment, and all is done. Somebody else might receive a message and maybe, not understand the value. I feel fine. I don't need a visit right now. Even cancer screenings, right? There's a lot of metrics in value-based care around different cancer screenings. And so we're actually launching a project right now that uses a combination of text outreach, and we're embedding an AI agent within the text message itself. So it's specific to lung cancer screening. And so this is a cohort of patients who are at higher risk based on their age, their smoking history. And we're doing outreach to them to really do some education. Why is lung cancer screening recommended for you? What does it mean? How would you do it? What does it cost? How do you prep for it? What should you expect as a patient? And so instead of, we did a version of it, actually, this a similar project with this client that we're still working with several years ago. And it was much more templatized. There was like FAQs, and the patients could review them. And we got really great results, right? The success rate in terms of the increase in screening rate was impressive. And we did it during COVID, so even more impressive. But now it's going to be really exciting because someone might say, oh, this is recommended for me. I'm going to go ahead and make that appointment to proceed. Someone else may say, I have no symptoms of that. I quit smoking a long time ago. I'm not going to do it. But this agent can now give them a lot more insight to why it's really important, right? Even if in the absence of symptoms, you may still be at risk, right? And so blah, 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 right? So it can be very in tune to the needs of that patient at that time. And, the really interesting thing about it is patient engagement, like people engagement, it varies even with the same patient on the day, right? If you're a busy mom and you get this message and you're trying to get dinner and you have kids all over, you're not going to be as receptive, right? If you get a follow-up reminder to that and you have a little bit of peace and you're like, oh, I'm going to be a little bit more dialed in, or, oh, I meant to follow up on that and I never got back to it. And so there's a lot around the behavioral economics, the science of engagement that they're really fascinating when you think about, what is the right timing or cadence of messaging, but being able to offer something that is so much more meaningful, right? Because if I can ask questions that matter to me as the recipient, and I can get those answers in real time, not just, call your doctor tomorrow, then that is the likelihood of me engaging is much higher, right? Because now I'm getting the information that I need to make whatever decision, right? To proceed with the recommended care or not.
Totally. That makes a lot of sense. And then when we're thinking about sort of that in the broader context of messaging, I am curious if you're going to sort of get a little bit of a soapbox moment because messaging is so critical to just patient outcomes and care and all sort of for all of the innovative reasons you just described. If you could put a spotlight on anything happening in messaging right now, what would it be?
So I think it's really a lot of what we're talking about, right? It's the shift from it being something that is the same person, the same message is being received by everyone. So that's a huge shift. The other piece is, we as consumers, right? We talk about patients, but patients are just people having a healthcare experience. And, in a lot of different settings, we're still encountering whether it's a chatbot or a phone call, that IVR, that phone tree, and you're getting stuck in this loop and you're trying to just say the one thing you need, right? And the organizations that are not moving away from that are really going to have a very negative impact, and healthcare included, because consumers want communication to be easy. And even though healthcare is limping along, they're not going to get a pass forever, right? We're having those more conversational experiences that we're not getting caught in that loop. And so that with that expectation is passed over to healthcare as well. So I think beyond that kind of one size fits all approach that we started with, it was great when that was all we had. But now the more context aware interactions that a patient can have, anytime, day or night, I think is going to have a huge shift, not only on the patient experience, but also clinical outcomes, right? And so when we talk about healthcare outcomes, it is something certainly that every, clinician, the provider, the nurse, anyone on that team, they want that, but it's not just because it's the right thing to do in terms of care, but it's the business of medicine, right? Value-based care and all of the risk-based contracts. It is essential to have tools like this, or you're not going to be able to achieve those goals.
Caitlin and I are in a unique position where we've gotten to interview a lot of different people who are using text messaging to do whatever it is their goal is. It's really cool that this technology, SMS, and any of the other things, like it is being used by Providertech to increase better outcomes for patients. And at the same time, it's being used by e-commerce vendors to get them to sell more products. It's just a really cool thing to be on the other side of it. But
right, all those different use cases, right? It is fascinating because
so
it goes back to just the tools, right? This is a tool. How do you use this tool? And in some settings, the tools are used more effectively, and that goes to back to what I was saying in terms of timing, right? A lot of times these tools exist in the electronic health records to a degree. But now what happens is now the organization who already has a to-do list, that's running away from them every day, now they're also responsible for sending out messages, determining the right type of message, determining the right frequency of messaging, building out their population, et cetera, et cetera. So I think the importance of having someone who really, yes, has the tools, but understands the science of engagement is a really important partner in the healthcare space and probably in any space.
Yeah, very true. So probably giving you another soapbox moment, which that is what we are trying to do for you, Lisa. When you think about 2025, this coming year, kind of twofold question. Anything that you're really excited about as far as messaging as a whole, or is there any use case or product innovation you're really excited about that's coming down Providertech's roadmap that will help your customers?
Yeah. So I think the thing really that I'm most excited about is this really interesting inflection point that we're at with AI, right? When we're talking to our existing clients, potential new clients, there are, AI solutions that are for every problem, right? Seemingly, right? They're like, oh, we already have something like that. I'm like, well, what is it doing, right? So like, let's make sure that we're talking about the same thing. So I think that, the industry is really quite flooded with these types of solutions today. I'm really excited to see in the next 12 to 18 months how that settles in, right? I think we're going to really have much more understanding on how do these AI tools can be best utilized to provide value to the patients, to the provider, to the health plans, et cetera. And so I think it's exciting to have a front row seat, if you will, to be in this space and to have these tools ourselves to really be part of this wave. And, I think for us, the really exciting thing is, when I first started with Providertech, even as a user, sending text messages to patients was a brand new concept, right? And we were very innovative at the time. And so it now feels like we're in that second wave of, how are we making it easier for people to communicate with their healthcare team, or even their payer, right? That's an important piece of the equation as well. And we work with payer clients as well. So it's exciting to think about how are these tools that we're providing our clients making it easier and reducing those barriers to them accessing care or getting simple information that is most relevant to them or their families.
This is at risk of taking us down a rabbit hole completely irrelevant to messaging. I do want to ask, have you actually been looking at what the HIPAA and BAA implications are of like an AI tool, for example? I mean, I just speaking from experience having to productize our own, right? So when we work with healthcare companies, we have a BAA agreement that we will sign with healthcare companies saying that we are going to treat the information that traverses our network in accordance with HIPAA rules, regulations, and things like that. I'm just super curious if you've had to deal with that already in relation to some of these new and emerging technologies that you're working with.
We've taken a very proactive approach because, as you know, the technology is moving faster than the regulation around it.
Always.
and so what we've done is just that. We've fallen back on what we do know, right? We do know in terms of what does HIPAA mean and the regulations that we were already operating within, and ensuring that these tools are aligned with that, right? And that's signing BAAs that include this language, as well as making sure we are using the ABCs of HIPAA, right? The least access, right? The not storing any of the data after the interaction happens, and that only lives in the place where the client can access it for their own records, right? Not within our agent memory, if you will. And so we've been very intentional about that because the healthcare data, the risk is very high, and so we took a very intentional approach as we set out on this path. We also did achieve our SOC 2 certification last year. And so part of that certification is an ongoing evaluation, monitoring, checking in, and all of the work that goes along with that. And so, we've just weaved this into that certification, and our practices and behaviors accordingly.
That's awesome. I figured as much. I was just curious what all you were doing to prepare for. So really great sort of best practices that you just laid out to sort of follow for other listeners that are entertaining that in the space.
I also am going to just mention that, any new technology, there is often fear around it in the healthcare space because of the sensitivity. We do have, our internal team, but I also have worked with some colleagues that have a fractional CTO, CIO type of company that is specializing just in this, right, as these technologies are emerging. And so I think that I do just want to mention that, because if it is an organization that maybe they even have those roles in their organization, but they don't have that understanding of how to navigate it. There are solutions like that you can engage someone in a short-term engagement and help set up your organization in a way that your data will be safe.
Totally. That makes sense. Just like they would, come to sort of a provider like yourself for specializing in sort of messaging guidance, consulting the right bodies for best practices as we're dealing with some of these like emerging technologies or existing technologies that just may be new to that organization.
Exactly right.
So one of the questions we like to ask all of our guests as sort of a lighthearted way to end the podcast is, what is the best text message that you've gotten this week?
So I have a 21-year-old son who is away at school. And so anytime I hear from him, which I did just yesterday, so I would say that probably is the top of my list. We also did recently kick off a new project with some of the tools that I'm mentioning here. And it's a client we've worked with for a long time. So we have a great working relationship. And just as they reached out and they were like, oh my gosh, this just happened in this conversation. And they're seeing a lot of great, even early successes. And so that was really exciting to see them excited about it and to be able to bring that back and share with my team. So I would say those two.
That's awesome. One more for the sons and daughters. They're winning the podcast poll so far. Well, Lisa, thank you so much for joining us. I do want to make sure that our listeners can connect with you afterwards if they would like to. So if people want to reach out for more engagement with you directly, where can they find you?
Yes. So you can find me in a couple places. I'm on LinkedIn. My last name is Tejada. And that will be in the show notes if you're not sure how to spell that. And my email is just my name, lisa.tejada@providertech.ai.
Awesome. Thank you, Lisa. And thanks again for joining us today. Thanks, listeners, for tuning in. And you can find more episodes on Spotify or Apple Podcast, or you can look at our faces, our beautiful faces, and watch this season on YouTube. And be sure to head over to stateofmessaging.com. That's where you can download your free copy of the 2025 State of Messaging Report. And you can learn more about the 2025 Textie Awards.
Woo woo.
All right. We'll catch you next time. Bye.
See y'all.